Going to do a wrist mobilization with movements following a foosh injury, so most likely that extension motion is going to hurt. So first we're going to have the athletes just extend the wrist. Note for any restriction, decreased range of motion, especially compared with that bilateral one. So go ahead and do it on the other side. You can rate their pain, and then I'm going to just have you hold your arm there and apply pressure in opposite directions right across that joint line. So first I'll start this way. Have her extend. Does that feel better?
No.
Okay, so then I'm going to switch my hands and do it the opposite way. Go ahead and extend again. That way feel better?
Sure.
Okay, so we're going to do, if that way feels better, we're going to do 10 repetitions. So she's going to extend and then apply some overpressure with her other hand and then relax. Back down, same thing, and overpressure. And we're going to keep doing that for 10 repetitions. And then after 10, we're going to have her do it again. See if range of motion increases and pain decreases. And if not, then we're going to keep doing about 3 sets of that 10 repetitions. Pain should basically be diminished and range of motion should increase. The restriction should be corrected due to that positional fault that we are trying to correct following that foosh. Wouldn't want to do this on obviously a fracture, dislocation, anything like that, but it is important to always check for positional faults, because if you keep working on maybe just the ligaments or just the muscle injury and it's really a joint misalignment, then that injury isn't going to get any better. The results should be immediate, hopefully long lasting, and absolutely pain free. If not, then the treatment needs to stop immediately. There are taping methods that will help this mobilization last a little longer. Next we'll do another Mulligan technique for the MTP joint. So say flexion is sore, so we're going to have her just flex her toe. So bring your toe down, there you go. And again, no any restrictions, pain, anything like that. And then we will start again applying force at that joint line. So I'm going to push this one in, stabilize here at that MT, and then take that proximal phalanx and push the other way. And then go ahead and flex again, toe down, and say that one doesn't feel better, then we'll go this way and do the same thing but in opposite directions and go ahead and flex. But most likely that first way I did is going to feel better, so we'll stick with that way. And then you can add some rotation, so first I'll rotate it up and go ahead and flex again. If that didn't feel as good as you'd like it, then we'll rotate it the other way, but keeping that pressure the same way. And then go ahead and go down. And if that way feels the best, then we'll do, again, 10 repetitions, and then she can, with her other hand, sit up and do some more overpressure. So go ahead and flex, and then push down with hers. I like to have the athlete do it so she knows kind of where her end range is rather than me doing it. So again, joint line pressure, rotate, flex, and then overpressure. Okay, and then relax. So we'll do that, and then she can go ahead and flex her toe again, see if that feels any better, and then we keep doing about 3 sets of that 10 repetitions until pain is gone and range of motion increases. Again, trying to correct that positional fault. Results should be immediate, pain-free, like I said before. If not, then it needs to stop and try something else. Note her restriction, kind of her end range, before I come in and add a little bit of distraction force, and then lift her up kind of right until that range of motion. Then I'll kind of add a little bit more traction and go beyond her end range until she can feel that stretch. We'll do that 3 times and kind of just hold the traction there, hold that stretch. So you only want to do 3 repetitions on the first day. And basically this is just distracting the nerve pain to increase that range of motion, which you can see was immediate. At first she probably felt that kind of tingling down her posterior thigh or leg, and that's indicating more of a nerve issue, and then by distracting it, then she is able to just stretch that muscle instead of the nerve and kind of increase that range of motion by decreasing the tightness. If that maneuver doesn't really make that kind of tingling disappear, then you can add some hip abduction or slight rotation and kind of change the angle a little bit and see which makes the pain disappear. And then after our repetitions, she can do another active straight leg raise and notice how much more range of motion she got on that one. So the treatment is working, and then she can come back the next 2 days, the next couple days, and do 10 reps of that